Hello students, welcome to FMT Guru. We are going to discuss NEET PG 2023 Forensic Medicine and Toxicology question. I am Dr. Manjunath, Faculty of Forensic Medicine and Toxicology. There are some 10 to 12 questions asked in the examination. The question number 1, type of autopsy technique in HIV positive dead body. So, HIV positive dead body. We discussed in our classes type of autopsy in infected bodies. Hepatitis B, HIV, your answer should be Rokitansky technique. So, according to KSN Reddy, the good answer or the best answer for this question is Rokitansky is the correct answer. Virchow is the most common technique. Letule is the best technique. Gone is organ block technique. So answer for this question is Rokitansky. There are 4 techniques of autopsy organ dissection. The first one, removal of organ one by one. So that is known as 1 by 1 technique. That is known as Virchow technique. Okay. The second method, where organs are removed in blocks like cervicothoracic block, abdominal block, pelvic block. So this is known as Gone technique. You can see here heart, the lung and thoracic structure, cervicothoracic block, which is known as Gone technique. And the third one, which is known as NMAS technique. NMAS technique, that is known as Letule technique. So in NEET PG question was asked about Letule. The best technique is Letule, the most common is Virchow. And in situ dissection, that is known as Rokitansky technique. So this is the very important topic taken from medico-legal autopsy chapter. The question is simple. Next. Second question. During postmortem examination, dead body temperature is more than 39 degrees. This phenomena is seen in. So here, what is this phenomena? Dead body temperature is more than normal for at least first 2 hours. So that is known as postmortem caloricity. So here the examiner is asking about PM caloricity. PM caloricity. So PM caloricity can be seen in septicemia, not intra-abdominal hemorrhage. It can be pontine hemorrhage, but not intra-abdominal hemorrhage. Corrosive death, no. It can be seen in strychnine poison or tetanus poison, but not in corrosive death. Cyanide poison, hyperthermia can be seen, but here the question is dead body temperature. So the better answer for this question is B is the correct answer according to KSN Reddy 35th edition. So what is postmortem caloricity? Temperature remains rise for first 2 hours. What are the causes? Sunstroke, heat stroke. Remember, sunstroke and heat stroke, sweating is absent. Tetanus, strychnine poison, Septicemia, pontine hemorrhage. What is the fatal dosage of strychnine poison? 1 seed. It is bitter in taste. It is a spinal poison. So, sunstroke or heat stroke, sweating is absent. This is last INI-CET question. Question number 3. So, question number 3, it is asked in NEET PG exam. It was also asked in INI-CET exam. It is a repeat question. A child while playing came with a history of painful swallowing, photophobia, not able to pass urine with dry hot skin. Which of the following is true regarding diagnosis of poison and antidote in the case? What do you think, all of you? Painful swallowing, dysphagia, dysarthria, double vision, dilatation of the pupil, dry hot skin, restlessness, delirium, all this. So go in favor of deliriant. So what is the deliriant given here? That is Datura. So Datura is a deliriant here. Datura presents with the signs and symptoms of atropine poison. Datura contain hyoscine, hyoscyamine and traces of atropine. The fatal dose is 75 to 100 seeds. So answer for this question is Datura. Okay. Datura, the treatment is physostigmine. So just a brief explanation. Datura, the fatal dosage is 100 to 125 seeds. Fatal period is around 24 hours. It manifests with 90 manifestations. Why 90 manifestation? Because of effect of hyoscine, hyoscyamine and traces of atropine. So there can be dysphagia, dysarthria, dilatation of blood vessel, diplopia, dry hot skin, drunken gait, delirium. Remember, delirium is known as muttering delirium, and there will be a sign known as carpologia. So carpologia means patient presents with some hallucination. So he will be pulling some imaginary threads from his fingers like this. So that is known as carpologia. Drowsiness, dryness of the mouth. So all this because of what effect? Because of hyoscine. Hyoscine or hyoscyamine or traces of atropine effect. Treatment: gastric lavage, physostigmine and pilocarpine. So in the picture you can see Datura seeds. So you can see here Datura fruit and Datura seeds. So Datura seeds are double-edged. They are kidney shaped, brown in color. Fatal dose is 75 to 100 seeds. So Datura, remember Datura, so it is a deliriant poison. So it is a road poison. It is a road poison. And Datura, in next exam there can be a question about image based question. So the image A, that is Datura. So this is Datura seeds and this is capsicum seeds. Capsicum causes human hand. So you can see capsicum seeds are single-edged, yellow in color, somewhat round. They are not kidney shaped. So here this is carpologia, and Datura is a well-known road poison, train poison mixed with the food and other food items. Okay. The question number 4. I think question number 4, it is again a repeat question. So it was about the yellow needle-shaped crystal. So this is a question I got from one of my student. So he said this was the question asked. A 5-year-old child with a history of perianal pain brought to OPD and subjecting specimen from the perianal region, yellow needle-shaped crystals of spermine picrate. So whenever this question asked, so they're asking this question since last 3 years. So this is yellow needle-shaped crystal of spermine picrate. The answer is very simple, Barberio test. So answer for this question is Barberio. So we discussed in live classes Barberio, spermine picrate. Florence will produce dark brown crystals. So Takayama and Teichmann test, they are the test for the blood stain. So they are not for the seminal stain. So answer for this question is Barberio test, spermine picrate test. So let me discuss in and out of seminal stain. So seminal stain identification, it comes under trace evidence. So the mnemonic is A, B, C, D, E, F, G. A for acid phosphatase. So acid phosphatase is one of the very commonly used tests for the seminal stain identification. We can use ammonium molybdenate also. That will detect phosphorus in the semen. Barberio test, which is, we use picric acid. So picric acid combines with the spermine, forms spermine picrate. So because of the presence of, spermine in the prostatic secretion. C for creatinine phosphokinase, Christmas tree staining of spermatozoa, which is a confirmatory test. D for dehydrogenase, lactate dehydrogenase test, which is the most specific biochemical test. And in dry semen, so we use UV rays that looks bluish white in color because of the choline protein or the flavin protein present in the semen. ELISA test, Florence test. So Florence is nothing but choline in seminal vesicle. So if choline in seminal vesicle, choline iodide crystals, dark brown, then your answer will be Florence test. And G for glycoprotein P30 test, which is one more very commonly used test nowadays. Okay, so if yellow needle shaped crystals are given, Barberio. If choline iodide dark brown crystals are there, then it must be Florence test. So this is about seminal stain. So if question asked about blood stain, Takayama and Teichmann, and other test, that is a screening test for blood stain. Yes, there is Brentalamine fast blue test. So in Brentalamine fast blue test, naphthol Brentalamine that forms purple color. So that is also one test for the seminal stain. You can see here, this is the dark brown rhombic crystals. So whenever question asked about dark brown rhombic crystal, your answer should be Florence test. Whenever question about yellow needle shaped crystals, Barberio test. This is acid phosphatase test. Acid phosphatase. This is a dry semen. So dry semen which is visible under UV rays, bluish white in color. The most confirmatory test is the visibility of the sperms in the staining, that is Christmas tree staining. That is the most confirmatory test. Next, question number 5. Death caused by act done with intent to cause miscarriage. Intent to cause miscarriage. So what is the answer? Yes. So here this question about criminal abortion. Criminal abortion is a punishable offence under the section 312, 313, 314. So 312 to 314, they are related to criminal abortion. Here death is given. So death of the pregnant while doing criminal abortion, then it is punishable under 314 IPC, correct answer. So this is the correct answer. 313, criminal abortion without consent of the mother. 312, criminal abortion with the consent of the mother. 320, grievous hurt. So the answer for this question is 314. That is the best answer. So abortion, again, it's very commonly asked. So MT Act is also very commonly asked. Abortion, what is abortion? Abortion means expulsion of products of conception from the uterus at any period before full term. So this was again repeat question in NEET PG. Before full term, that is the legal definition. So methods, abortifacient, again it's a repeat question. It can be asked in upcoming exam. General violence, local violence. Criminal abortion with consent, that is 312. That is 3 to 7 years of imprisonment. Criminal abortion without consent, 10 years to life, 313 IPC. Criminal abortion with death of the pregnant, then it is 314 IPC. So, answer for this question 314. So, 312 causing miscarriage, 313 we discussed, 314 we discussed, 315 again it's a repeat question. Act done with intent to prevent child being born alive or to cause it die after birth. 316 causing death of quick unborn child. So 317 again it's a repeat question, you must know. 319 repeat question, that is hurt. 320 grievous hurt. Okay? Yes. Next question. A 76-year-old man presents to emergency department with an increasing somnolence, lethargy. His symptoms developed on the day of admission. His symptoms are associated with headache, mild nausea, no vomiting. So vomiting is not there. So there is history of fall. So history of fall is there, and crescent shaped hypertensity, crosses suture line, and all these signs and symptoms go in favor of dash. Subdural hematoma, extradural hematoma, subarachnoid hematoma, intracerebral hemorrhage. What do you think, all of you? Old age, so it crosses suture line, history of fall. So all this go in favor of SDH, subdural hematoma. Subdural hematoma crosses suture line. EDH does not crosses the suture line. Concavo, convex. So SAH, remember subarachnoid hemorrhage because of rupture of berry aneurysm. It is not ICH. So the better answer for this question is SDH. SDH is because of bleeding from the bridging veins. EDH usually from the bleeding from the middle meningeal artery. So the trauma is the most common cause. Again, it's a repeat question. Last NEET PG 2022, the question was about SAH. Now it is about SDH. So this is what epidural hematoma and subdural hematoma. Epidural hematoma usually unilateral. Subdural hematoma usually it can be bilateral also. In subdural hematoma, bridging vein is the cause. In epidural hematoma, middle meningeal artery. Okay. And remember, epidural hematoma associated with lucid interval, a period of consciousness between the two periods of unconsciousness. So in that, the person can make valid dwell, and discharging patient during lucid interval, it can amount to medical negligence. All these are important questions asked in previous exams. Question number 7. Patient presents with redness, swelling, bruising, excessive uncontrollable bleeding, severe pain, tenderness at the site of bite, nausea, vomiting, diarrhea, labored breathing. So all this go in favor of either it is viper bite, which is hemotoxic, or it can be scorpion bite. So if bleeding manifestations are given, that means it is hemotoxic. It is not crate bite. Crate bite is painless. It resembles like stroke. It is not cobra bite. Cobra bite present with the neurotoxic symptoms, ptosis and other features. Broken neck sign, all this in case of cobra bite. Scorpion bite and viper bite. So it all depends on the proper history which is given in the exam. If uncontrollable bleeding, redness, swelling, bruising, all this go in favor of, I'll go in favor of viper bite. So A is more than B. Because this is asked in one of the INI-CET exam, one of the very important finding in case of scorpion bite. Scorpion bite, the finding is that is excessive pain, uncontrollable pain it is. So that is the very important finding that we'll discuss in next slide. So I think it is viper bite than the scorpion bite. So as we know, snakes very commonly asked in the exam. So this is the common cobra, naza, which has a hood, spectacle mark, fatal dosage 12 milligram, 30 minutes to 6 hours is the fatal period. It presents with the ptosis and neurotoxic symptom. So this is Russell's viper. You can see the triangular head, 3 brown spots over the dorsum of the snake, triangular head, constricted neck, broad body, pointed tail, 15 mg, 1 to 2 days. It presents with the bleeding manifestations. Russell's viper, scientific name Dubai russelli. This is saw-scaled viper. Saw-scaled viper again presents with the viper symptom, increased clotting time, increased bleeding time, DIC. 8 mg, 1 to 2 days is the fatal period. Then one finding is bird foot mark. So this is the common crate. Common crate. So common crate, it is a neurotoxic snake. It comes under Elapidae. So 6 mg. This is a repeat question again. So common crate, the fatal dosage 6 mg, 3 to 6 mg. It is one of the most fatal snake among the all 4. Elapidae, Viperidae and Hydrophidae. Elapidae presents with the neurotoxic symptom. Viperidae presents with the hemotoxic symptom. Hydrophidae presents with the myotoxic symptoms. So this was the question asked in NEET PG 2019. Which of the following acts as a physiological antidote to scorpion venom? So that time this question was asked. The answer it was prazosin. Because scorpion causes release of adrenaline, noradrenaline from the adrenal gland. So physiological antidote, it was answer, it was prazosin, correct answer. C. And same scenario was given here. Okay. Scorpion, remember, it can be hemotoxic, it can be neurotoxic also, it can be cardiotoxic also. Toxicity more than snakes, but death is very rare. Why? Because of the amount of venom injected is very small, but it is very fatal. The snake snake venom and the scorpion venom, the venom of scorpion is more toxic than this snake venom, but the amount injected is very small. Adrenal, so adrenal gland, it releases adrenal hormone. Prazosin is the physiological antidote. So xylocaine, calcium gluconate, barbiturate, atropine can be given. Okay. So this was the question asked in INI-CET. Look at this. A 3-year-old child sleeping in a hut woke up in the middle of the night screaming. Her mother thought the child had nightmare, tried to pacify her. Here the symptom is sweating, profuse sweating. Hands are becoming cold, vomiting, and you can see the pulse rate is high, BP is low. So, and here the important finding, remember in scorpion bite, there will be extreme pain. So that is the classical presentation of scorpion bite. So uncontrollable bleeding, all this go in favor of viper bite than the scorpion bite. Question number 8. A 20-year-old man presents to emergency room after intentional overdosage of aspirin. So there was a question about aspirin poison. He reports ingesting an unknown amount of aspirin. Okay. Aspirin poison. He presents with, nausea, vomiting, tinnitus, so lactic acidosis. All these are the features of aspirin poison. So I think in exam there was a question about aspirin, consumption of more than 100 tablets of aspirin. So here options are: treatment includes activated charcoal, alkaline diuresis, hemoperitoneal dialysis, all the above. Some students say which of the following is not the treatment. So that is also correct, fine. But remember, in any case of aspirin poison, activated charcoal is given. That is true. Alkaline diuresis is done. That is also true. Yes, when aspirin dosage is more than high, So more than more than high in the blood, you can do hemodialysis and peritoneal dialysis. So A, B, C, all the three are correct. So I'll go with the D is the answer. All the above is the correct answer. So sometime they'll give some other option which is not the treatment. So then that will be the answer in that case. Okay. So answer for this question now it is D. So A, B, C are correct. Some students say N-acetylcysteine was given. Then that is given. That is the correct answer. If some other antidote given, that is the correct answer. Okay. Because N-acetylcysteine, it is given in paracetamol poison. Then question number 9. A chronic alcoholic presents with confusion, loss of muscle coordination. So there is a ataxia. There is a vision changes known as nystagmus, double vision, eyelid drooping, sixth nerve palsy. So all this go in favor of mnemonic known as GOA, global confusion, ophthalmoplegia, ataxia. So what is the best answer? So best answer it is Wernicke encephalopathy is the correct answer. Run amok, no. Run amok is seen in where it is seen. Run amok is seen in chronic cannabis poison. It is a type of impulse disorder, impulse of killing people. Korsakoff psychosis. Yes, Korsakoff psychosis, Wernicke encephalopathy is seen in alcoholism because of vitamin B1 deficiency. But here the clinical feature go in favor of Wernicke. So Korsakoff psychosis presents with the psychosis and confabulation. Okay, approximate answer. So delirium tremens, no. So answer for this question is Wernicke encephalopathy. So Wernicke encephalopathy is equal to GOA, global confusion, ophthalmoplegia and ataxia. Okay. Wernicke encephalopathy. So there are 4 important signs and symptoms, clinical diagnosis, that is known as Kane criteria. So 2 out of 4 that is needed for diagnosis. Altered mental status, memory impairment, there can be nystagmus, there can be cerebellar dysfunction, dietary deficiency or alcoholism. Treatment is thiamine. So treatment is thiamine is given. Okay. Korsakoff psychosis presents with anterograde, retrograde amnesia, confabulation. Again the treatment is, that is the thiamine is the correct answer. So this was asked in INI-CET 2020. Look at this. A 40-year-old man presents with lethargy confusion. Lethargy confusion. Patient accompanied by his friend, he reports that he is a well-known alcoholic and there is physical examination, patient is having ataxia and horizontal nystagmus. Again, so this was asked in INI-CET. This is going in favor of Wernicke encephalopathy. Wernicke, it is asked in 2020. Same question, same concept was asked in the exam in NEET PG 2023. Here, can I answer this question? 64-year-old man with a history of chronic alcohol use presents to primary care clinic and he was having problem in recall recent events. When asked question, he responds confidently with the incorrect answers. So incorrect answer, approximate answer, confabulation, all this go in favor of Korsakoff psychosis. This was asked in previous NEET PG exam. Korsakoff psychosis. Okay, it's all actually the concept. If you know the concept very well, then you can answer any type of question in any exam. So that's it about the almost 10 questions asked in the exam. So I request everybody to revise, to take rest today. So for next few days, don't worry about the question and answer, all these things. Take rest, exam is over. So thank you.